Merhaba, günaydın herkese. Saat 11'i.
Good morning, everyone. 5 past already. I'd like to start. Those of you who don't know me, I'm Funda Gajay. I am HEAL, Health and Environment Alliance. I'm in charge of Turkey's energy and healthcare policies there. And I'm the chief editor of the report, Chronic Coal Pollution and its Cumulative Health Impact will be introduced today. Thank you very much for making the time to be with us today. HEAL, Health and Environment Alliance, has been working on the healthcare impact of coal pollution in Europe for a long time. We've been active in Turkey since 2015. And again, coal-fired thermal power plants, electricity production power plants, we're examining their pollution that they cause. The research we're going to be talking about is part of a series, a special part of that series, because this report has calculated a cumulative impact. We looked at the last 55 years and looked at its healthcare cost. And in 4 regions, we're going to be presenting you with some assessments on those 4 regions. Soon, I'll be presenting the work of the research, and then one of the 4 regions, Professor Sabahat Genç, living in Muğla, will convey her observations as a physician from the region, and we'll talk about the healthcare impact of air pollution. And lastly, will be with us, and she's going to be presenting a perspective from other countries. We'll have Q&A last. For Q&A, while I'm speaking or other speakers are speaking, if you have anything that comes to mind, please write those in the Q&A section. You don't need to wait until the end. Especially, please use the Q&A part, not the chat box, because when you use the chat box, only we can see those, but if you write those on the Q&A, everybody can see. And you'll encourage other people to ask questions. If everything is okay, I will start with my presentation. Can everybody see the presentation? Hope so. Yes,
yes, it all works.
Harika. Varsa onu da yine bize chat box'tan veya soru cevaptan.
Okay, if there are problems, please write those on the Q&A. As I said, chronic coal pollution, the cumulative impact on healthcare in Turkey. I'll talk about HEAL first. More than 90 institutions, over 28 countries are represented, an umbrella institution, public health specialists associations, they're whom we collaborate with different patient groups, nurse associations, we work with them, represent them. Environmental healthcare burden is what we're working on, WHO and other global organizations. We're part of the environment work of other institutions. We mostly work on air pollution. Depending on WHO, air pollution is the biggest healthcare threat, which means air pollution is what causes the majority of healthcare problems in Turkey. The air pollution in our homes and outside cause 7 million early deaths every year. And it's a cross-border problem. Turkey had ratified the Paris Convention years ago, and 2053 net zero carbon has been announced, but no date or plan for exiting the coal. When they will be decommissioned is not known, and coal's share was 34% in 2020. Basic reason for this report is each and every facility has emissions into the soil, air, and water. But in Turkey, this is not clear, not known. So we're doing this research with international methodology so we can make an estimate. At least the polluters can announce their data. What sort of a method are we working on? What you see on the right is Ören thermal power plants, Kemerköy, This photo was taken just yesterday. It snowed in the meantime. Within the scope of this work, 50 megawatt, which are called large in terminology. We reviewed those thermal power plants. Some are imported coal, some are local coal, asphaltite, and local lignite were used by those. In those power plants, the oldest is Kütahya-Tunçbilek. Therefore, we started in 1965. It's the oldest thermal power plant, Kütahya-Tunçbilek. So we took 1965 as a base, and until 2022, we extended the model. And inside the model is Pşates thermal power plant in Zonguldak that has been decommissioned, or there are Yunus Emre, which is ready to be commissioned, but it's not being commissioned. These are not included. But what have we included? In this research, 16 provinces, 30 power plants. What you see on the right-hand side, after this press conference, this will be sent out, where each and every power plant is, what sort of health burden they cause, early death, asthma, and healthcare burden. You're going to be able to see values such as these 30 power plants in 16 provinces, which means 19.2 gigawatts of power. What has been left out? 1.1 gigawatt of much smaller thermal power plants are left. So all coal-fired thermal power plants have almost been examined. Muğla, Kütahya, Manisa, Sivas, Maraş, Ankara, Adana, Hatay, Zonguldak, Çanakkale, Bursa, Kocaeli, Şırnak, Bolu, İzmir, and Yalova. 16 provinces. And not only those provinces, but of course, the areas of these provinces are impacted by air pollution. The data is not accessible by the public, and because of that, the emissions reported by the facility have been taken, if these exist. If these exist, and if they have once been measured by the ministry, we have taken that to be the base. If there is none, coordinates of power plants, environmental impact reports, treatment systems, chimney systems. We looked into those data, and here with international models with polluter burdens, and the ministry is also using those, we estimated the emission. How much emission can each and every power plant cause? If there's chimney gas treatment system in the power plant, we just accepted that was in line with the regulation. Is it working? Is it not? But we said, okay, annually, this is the data that the ministry shows. We're sure they're in line, and we then evaluated those over the map, and we estimated the population to come up with a healthcare burden. Again, the economic situation of Turkey, purchasing power, various parities have been reviewed. The results are in 55-year-old report card. Healthcare costs 4,008 billion Turkish lira. This is almost last year's GDP in Turkey. 200,000 early deaths almost. And this is not limited with that. These are different early deaths and pediatric bronchitis cases. More than 200,000 early deaths, of course. I mean, the picture in general is much heavier. 62 million work days have been lost in the last 55 years, just caused by coal-fired thermal power plants. An interesting graph is that this is cumulative healthcare impact. Early deaths. We talk about carbon locking, but we're going to be talking about pollution locking, it seems. As you can see, cumulatively, the burden is increasing. Without closing down, decommissioning these power plants, you can't reduce this. And if the power plants continue the way they are, the burden will continue to increase. And there's a plan to increase coal capacity twofold, which I hope will not actualize. The most of Turkey, as you can see. After the meeting, you will have access to this data. The most polluted thermal power plant, which causes most of the early deaths, is Muğla Yatağan. Cost-wise, Soma Manisa causes the biggest healthcare burden. Yatağan and Soma were commissioned in 82, so cumulatively they have huge impact. Later on, Muğla, Yeniköy, Kütahya, 2 thermal power plants, Kangal in Sivas, and in Maraş, as you know from the press, Afşin, Elbistan A in Muğla Kemerköy thermal power plant, which many of you will remember from the Marmaris fire. From the coal mine to the power plant, the truck was caught on fire. Muğla Kemerköy thermal power plant, you can see, of course, cumulatively, once you go back, healthcare burden increases, but there are other nuances which we're going to be touching upon. And these nuances, we focused in 4 regions to review those. Muğla, where coal pollution is the highest, we can show with satellite images. Mining city Zonguldak, as we all know. Çanakkale, where power plants are intense. And ongoing constructions of power plants in İskenderun Gulf. These 4 regions, of course, the healthcare burden, they correspond to 40% of all healthcare problems in Turkey. Only 40% of the results of this report come from these 4 regions. The dirtiest, most polluted one is Muğla. There are 3 power plants, Kemerköy. Right to the north is Yeniköy, and further in, Yatağan, lignite coal. That's the one that you see on Bodrum Muğla Road. These 3 thermal power plants, the oldest ones were commissioned in 1982. 68,000 early deaths, 24 million lost business days, 1.5 trillion TL of healthcare costs. Muğla, as we said, it's the heaviest healthcare burden of all these regions. In other regions, there are milder health problems. Again, in the reports that we're going to be sharing, each and every power plant, you're going to see an open data set and estimation method for all of these 3 thermal power plants. You see the healthcare burden they've been causing. The important thing here is, as I said just now, the older the power plant, yes, the higher the pollution, but not just that. Whether or not there are filters have been discussed a lot in 2020. Sulfur dioxide reduction system, really. And in 2020, some power plants have been stopped temporarily. Thermal power plants in Muğla, when you look at it, in Yatağan, 26, in Yeniköy, 22, in Kemerköy, 10 years later, desulfurization system was commissioned, which is risky for the respiration system. Therefore, the picture in Muğla, the reason it's so heavy is that these power plants have not been controlled for air pollution. For years, sulfur was not checked. And the dates worked, of course, are reported 1 or 2 years later. But the figures are by day and by date. Day, month, year, as to when they were commissioned. One last thing about sulfur dioxide. In international work and satellite images show that Muğla is exposed to the highest sulfur dioxide pollution. And with that, Yeniköy and Kemerköy thermal power plants, those 2 ones that we see on the coast, their treatment system have to be replaced. So the details of the report will be sent in İskenderun, Hatay, Adana, 2 regions, 3 thermal power plants, Hatay, Atlas, Sugözü, İsken, and further in, lignite fired Tufan Beyli. These three power plants commissioned in 2003, 5,000 early deaths, 1.5 million lost working days. Enbah Unutlu. Enbah Unutlu thermal power plant, as you may have heard on the news, has been financed by Chinese banks, and this is the last power plant they're going to be financing. In spite of the health burden, this is going to be commissioned in a few months. The other finding in Adana is Adana in clean air action plans, there is no action mentioned regarding coal-fired thermal power plants. If WHO could have measured 1 out of 5 deaths in Adana may have to do with air pollution and could have been prevented. As I said, per power plant burdens will be seen on the reports. Another region, Zonguldak. In Zonguldak, we reviewed 4 power plants, 3 ZETES, Zonguldak Ören, and Çates B. Çates A thermal power plant has been closed down, so it's not included in the model. Also, healthcare problems are not included. In the oldest one is 1989, so between 1989 2021, 3,500 early deaths, 701,000 lost working days, and 132 billion TL healthcare cost. ZETES 4 and ZETES thermal power plants are planned to be commissioned, planned to be constructed. The other problem here is Çates thermal power plant. Again, there's sulfur dioxide control systems. Because they're not in regulation in 2020, it was stopped for 6 months, which means since 1989 until now, the control system, air pollution control system, was malfunctioning. And in our modeling, this challenged us because, as I said, if there's a control system and it has just been built, we agree that it's in line with the regulation. But if the control system has missing parts, and if the ministry has said this to be the case, then looking at the measurements, looking into those measurements was not necessary. We tried to estimate with a model to see what sort of pollution may have been caused by Çates. Last, Çanakkale. Çanakkale is where thermal power plants are densely found. We reviewed 5 of them. Lignite-fired, Çan 218 Mart. On the coast is coal-fired 1, Kirazlıdere, Çenal, Kirazlı, and Karaburun are the other thermal power plants planned in this region. In this modeling, the planned ones are not included. We looked at the existing ones. Between 2005 2020, they caused almost 3,000 early deaths, 1.12 million lost working days, and 1 billion TL healthcare cost. This is difficult to read, I know, but in Çanakkale, what we saw the most was filters are not the solution. 18th of March thermal power plant until 2021 worked without a filter. And in 2021, desulfurization method was established, and 98.5% is the efficiency with which it is expected to work. As far as we know, there are some problems in the filtering system as well, and they're trying to rectify. But if a desulfurization system is set up and efficiency is attained, reduction of air pollution will improve early deaths only 70 to 75%. I'm going to be finishing now, and I will turn it over to Dr. Sabahat. The last part of the report, you'll find 4 research reports, the visuals included, and there will be a detailed table for you to see. It's about healthcare burden, air pollution caused by each and every power plant, and we listed demands and recommendations. I will not go over these, but the most important is that we need a date by which we're going to be exiting from coal, so that alternative sectors may be regulated accordingly. And last, I did not write it here, it's on the reports, these emission data that we talked about. In recent months, a regulation was issued. Emission data will be announced soon, but soon is after 2023. Until 2023, all of these thermal power plants and the air pollution and the healthcare problems caused by them will continue to remain. Thanks to this work, power plant operators will prefer to report their emissions before 2023. We would like to hear those emission data so that similar works may be taken up by academicians and scientists in our country. This is all I'm going to say. Professor Sabahat Genç now. Hello. Thank you, Funda. Thank you, Heel, for this invitation. I live in Muğla, work in Muğla University, and I can observe many things here. Air pollution is a big problem all over the world, not just in Muğla. Air pollution and the resultant climate crisis are important problems. They threaten our future. Therefore, all countries of the world started to collaborate. Recently, in 2015, Paris Convention was ratified, and last October, what we have done in 5 years was a situation analysis. They convened in Glasgow to do that, but it was seen that none of the countries had fully fulfilled their promises. Important problem, really, because we don't have much time. We have to be active and rapid. Intergovernmental Climate Change Panel. There's a group, IPCC, and these from time to time issue reports about climate change. In their last report, there was a temperature increase of 1.5 degrees centigrade, a critical value. Abnormal weather conditions, abnormal temperature increases, floods, fires. These are results of climate change. And the formation of serious damage will come about once we exceed this 1.5 degrees centigrade. Work is underway, but it has been seen that within 2022, it seems that we're going to be reaching this 1.5, even exceed. We have to take very important precautions for the reduction of carbon emissions. We have to take very serious precautions. Otherwise, until 2100, this heat will reach 5.7 degrees centigrade, this increase, which will cause very serious problems, unfortunately. For instance, excessive heat we call drought, as you know, drought, and rise in sea levels. If this continues as is with such relaxed precautions, until 2100, many cities will remain underwater, and Istanbul and Izmir are among those. We need to take serious precautions. Air pollution is a significant healthcare problem everywhere. In many provinces, every year, WHO air pollution is always above the criteria set by WHO. What does it cause? Lung cancer, especially particle substance 2.5, small cell, dust going into lung and to blood, lung cancer, asthma, COPD, cardiovascular diseases, stroke, developmental retardation in children, may cause autism, premature deliveries, and mostly children, elderly, pregnant ladies, and those with chronic diseases suffer from the impact of air pollution, carbon emission, and climate crisis. Fossil fuels is the biggest reason for this. Therefore, many countries are coming up with dates to exit from coal, but in our country, we just ratified the Paris Agreement, but as yet, there is no plan. They say 2053, but there's no plan outlining what is going to be done. We have to come up with this plan, and we have to make exit from coal one of the priorities. There is work about air pollution. Kayhan Pala et al. Conducted a striking trial in 2018, especially particulate substance 2.5 exposure related. 44,617 early deaths because of that have been detected in Turkey. Again, based on yield findings, striking. And Muğla ranks 10th among the most impacted provinces. We have 3 thermal power plants, also many mines and marble mines, unfortunately. Muğla, since 1982, with the installment of thermal power plants, has been experiencing those. Most of the time, the public complains. There have been action suits brought against Yatağan, and they have been sanctioned many times. In 2020, October, again, there was excessive inversion and air pollution increased. Because of that, we had a crisis in Muğla. And here, this also was taken to court, but we don't know the results so far. Again, in Muğla, especially in Yatağan, in surrounding villages, the public in their own olive coves, their fields, they experienced problems. We were in direct contact with them. Many lung cancer cases came out of these villages, many respiratory diseases, they complain. We see them in our clinic, patients coming from Yatağan. COPD and asthma cases are very high, cancer cases from Yatağan. But of course, we have to put this forth in the format of scientific research, which we have planned. And for this, the Ministry of Health data were needed, and we requested. However, they said that protection of personal data law was given as an excuse not to share the data. Now, we're trying to do the trial in another way, but all research conducted outside of Turkey, national data is used. These countries share with researchers their national data, but in Turkey, unfortunately not. So I'm saying European states, I guess, are not as careful as we are about the protection of personal data. They must be very relaxed about this. As I said, Yatağan experienced problems. We saw these on newspapers. There were actions, legal actions. In 2021, we had a very serious air pollution case, whereby the governor's office took emergency measures. The Association of Turkish Physicians prepared a report back then, and here in Yatağan State Hospital and Muğla State Hospital, the applications were assessed, and Yatağan State Hospital, respiratory diseases, asthma, COPD, respiratory tract infections were 28% of all patients. In Muğla, this was 13.5%. And this shows the healthcare impact of air pollution. Apart from that, we know its impact on health, but the environment, the village people, it has economic impact on them as well, because they are expanding the mines in order to have more land, and peasants had to migrate because they had to leave behind the life they live and their traditions. Turgutköy is under the same threat now. Of course, it's been privatized, and they now have to battle with the company. Their olive trees are in danger of being lost. Soil efficiency is coming down. Cadmium and lead values in water is increasing. Again, cadmium and sulfur levels in the soil are above the desired levels, high in plants. A research on children, lead values were quite high. In fact, lead poisoning was above the limit, some research showed. Of course, a decision was made to decommission the power plant, but it has not happened, and these problems continue. European Climate Network has conducted a trial, and similar to the outcomes of this research, 45,000 early deaths has been reported in Muğla. Again, air pollution levels have been found high in Muğla. We know that. Again, there's Ember, active in energy. Nitrogen oxide is highest in Turkey and Yatan among all these power plants, again causing asthma, respiratory tract infections, nitrogen oxide, very high levels. While all these problems are there, while air quality should be monitored, since April 2017, unfortunately, air monitoring system has been malfunctioning. We cannot obtain air quality data. We have applied, asked many times. They say the device has broken down, but it's still continuing to be the case for 4 years. As you know, there was a disaster in Muğla last summer because of excessive heat. There was fire in the region. And after this fire, we saw that air monitoring station started to function, and they've been following the air quality data since then. Yes, in general, this is all I'm going to say. Big problem, air pollution. Fossil fuels are the most important source. First of all, we should be giving up on those. And for this, we need an emergency transformation, emergent and fair transformation. And one of the most important problems here is thermal power plants. We want them to be decommissioned, but many people work there, which is a social problem. That's why we need to have a fair transition. We should be creating employment for these people. All of these need to be planned. Otherwise, this world will not be sustainable for people. One more thing I'd like to share. In Muğla, there are 3 power plants. Muğla contains forestry more than 60%. Unfortunately, as a result, in the summer, a big part of forests were lost due to fires. Thermal power plants, in order to obtain coal, they are opening mines in forests. There's the İskenderun resistance, as you know, the pine forests. They don't want to lose their own habitat, these people. Apart from that, now there's a cement factory problem in Muğla. That's on the agenda. And for this not to happen, Muğla Environmental Platform and with other environmental organizations were struggling because, you know, that's coal-fired as well, cement factories. It's like a medium-scale thermal power plant. And while these precautions are being taken, the establishment, commissioning of a cement factory, when there is no need for it, we have excess of cement. And doing this investment for export, considering the circumstances of the day and of the future, is not logical, it's not healthy for the environment, for the people. The HEAL study in Turkey is very striking. The data for Muğla, especially, most of the deaths happen here. We, as people who live in Muğla, we were greatly upset. We should be ending this and doing a fair transition. Thank you. Thank you very much, Professor Sabahat Genç, Türk Thoracic Association Environmental Problems and Lung Health Working Group member. Thank you again. Now, before we go on to N, there's explaining translation. And
good morning, everyone. Thank you for your interest in this topic and for being here. And after what we heard today, I wanted to give you some information on the European developments on moving beyond coal. And this is something Funda mentioned at the beginning that my organization HEAL, but many other organizations from the health sector and from civil society have been engaged in and have been working towards, as the science is very clear on that in order to limit climate change, in order to protect the health, we need to get out of the coal power dependency as soon as possible. And it's actually something that also has been echoed and recommended by the International Energy Agency, who have recently highlighted that if we are to avoid the worst impacts of climate change, all countries and businesses need to immediately stop the construction of new coal power plants and phase out the existing plants completely. And the International Energy Agency recommends that all OECD countries phase out coal by 2030, and then the rest of the world by 2040. And in fact, Turkey is an OECD country. So we very much hope that these recommendations will be heard, as currently Turkey is still globally, the fifth largest country for new coal in the pipeline. So I have prepared some slides, which I will bring up 1 second. And in fact, what we're seeing is a very positive development for health, is that Europe as a whole is clearly on the way to relaying coal power generation to history. As of this year, we have 23 European countries that have announced they will phase out coal. We actually have some countries that are already coal-free. For many, they have announced a phase-out date of 2030 or even earlier. And these are not only countries in Western Europe, as you see here, these are also countries in Eastern and Southeastern Europe who have set a clear phase-out date. This includes Hungary, the Czech Republic, Bulgaria, Romania, North Macedonia, and Montenegro. And some countries have actually will be able to phase out earlier than foreseen, for example, Hungary, which will phase out coal by 2025. So what you see here is, most countries are green, even, as I said, in the whole of the European region. And unfortunately, there are only a couple of countries where there has been no official phase-out date discussion, and that includes Turkey, as you can see here. And this is data that has been gathered by a network that's called Europe Beyond Coal, where organizations, including HEAL and many others, are working towards a swift coal phase-out for health and for climate protection. Here's an overview again, and we can also provide this information, or you can access it at the website. Here's the information of when these phase-out dates have been set, and you see that actually the majority of these dates will be for 2030 or around 2030. There are also global developments, and there's an increasing global momentum to phase out coal within all countries and regions. And this includes the Powering Past Coal Alliance, which is a coalition of national and subnational governments, businesses and organizations working to advance the transition from unabated coal power generation to clean energy. And the Powering Past Coal Alliance now brings together 165 countries, cities, regions, and businesses. And in fact, nearly 2/3 of OECD and EU governments are now PPCA members and on the way to phasing out coal by 2030. And in addition, also globally, the last COP in Glasgow in November also saw a statement on global coal to clean power transition, which was also supported by many governments, not only in the European region, but also beyond, and not only heavily industrialized countries, but also others. So there is very much globally, a clear understanding and momentum to phasing out coal, with a recognition that we urgently have to take all measures to limit global heating. And this is also something that is recognized by the health sector, where we have seen, globally, important calls for phasing out not only coal, but actually all fossil fuels. Before the COP last year, there was a call from over 450 health organizations representing over 45 million health workers, and then together with individuals, who called on the heads of states around the world, as well as the national leads, for urgent action on climate to protect people's health. And this also includes the clear call to end all subsidies to fossil fuels, and then to ultimately and swiftly phase out fossil fuels. And phasing out of fossil fuels, including coal, is actually something that is recommended by the World Health Organization, as they have considered the evidence on climate change and health, the factors that are driving climate change, and have put forward 10 recommendations in a special report to COP26, which also includes the fossil fuel phase out. So with this and with my overview, I wanted to say that unfortunately, Turkey is one of the countries in the European region that hasn't set a phase out date. It was very welcome that Turkey has ratified the Paris Agreement and has set the net zero target. But in order to really protect our health and to tackle the climate crisis, we need to see also a swift setting of a phase out date. A coal phase out date is a no regrets option or no regrets measure for public health. And this is very much, we hope, what will emerge from the discussions in Turkey in the next months. And it's also a coal phase out also, as we have seen this morning, makes very much sense from an economic perspective, given the huge health impacts and costs that we have seen from Turkish coal accumulate over the decades. Thank you very much.
Thanks so much, Anne, for covering it up. Şimdi soru cevap kısmına geçeceğiz.
Now Q&A. First of all, briefly sharing the results of Çanakkale. We have the email of everyone, and after this meeting, we're going to be sharing with each and every one of you. We're going to be sharing the reports. Bülent Özgen, question, thermal power plants, unknown danger, Chrome 6. Any measures taken for that? Anything in the report for that? Now, to answer that briefly, maybe Anne would like to say something about that as well. Chrome 6, we did not include in this report. Heavy metals, as I said, will be, if we can report after 2024, heavy metals will be included. Chrome 6 may be included. I don't know, Sebahat or Anne, would you like to add anything about Chrome 6? I have no information on the topic. Another question for Turkey. What can be the alternative clean energy resources? Good research, exit from coal 2030. It says if we exit, alternative energy resources may reduce greenhouse emissions, greenhouse gas emissions. Exiting from coal, how can it be done? By protecting the safety of the grid. We are assessing the current state of affairs. And for next year, when we exit from coal, what sort of reduction can be made on health threats? We're going to look at Hazal has written last, exit from coal, an example of fair transition in the world. And could you answer that question? Is there a fair transition example from exiting the coal in the world?
Definitely, just transition is a key consideration in moving beyond coal, and it's very much a question that many governments are looking into. Just transition not only meaning not only providing for new jobs for the workers, but I think it's also very much about a just transition and a healthy transition for the whole coal communities and for the whole regions. In the EU, there's a just transition fund. It's being discussed with governments and also at regions, and we as HEAL, we've put forward some recommendations on how to make sure that the transition is not only just, but that it's also healthy. And that is definitely something that is of importance for Turkey as well, is looking into this. So it's currently going on, and there are definitely plans and measures that are being discussed that Turkey could take as a blueprint. Yes.
Thank you.
Thank you, Anne. Ali Osman has a note, says, especially in lignite-fired thermal power plants, radioisotopes should not be forgotten. 200,000 early deaths, and it costs we gave today is just air pollution. We should underline this is an underestimated figure. The realities may be way higher because we don't know whether they're abiding by the regulations. We're assuming that filters are functioning properly. We are making optimistic guesses. The population data are the recorded ones. Air pollution related, how vulnerable people can be, those figures, this methodology is the methodology of the WHO in the 90s. And WHO says people are a lot more vulnerable vis-a-vis air pollution. And on top of that, as Ali Osman who just said, if you include heavy metals and soil pollution, this figure will be a lot higher. Also, I see a long comment, the one in Kütahya Dumlupınar newspaper, Ahmet Dinç has written, has said, there's been, as a Kütahya journalist, Seyit Ömer and Tunç Bilek, the power thermal plants. What can you say about this? Ahmet Bey, as I said, we're going to be sending these. When we send the tables, you'll be able to see very openly the thermal power plants in Kütahya, Tunç Bilek, has been commissioned in 1965. Approximately 20,000 early deaths have been caused, and healthcare cost is 505 billion Turkish lira. Seyit Ömer, 490 billion Turkish lira. In the just transition that we have recommended, we keep saying health, but when we go to a private hospital, we pay out of our own pockets, or when it's a state hospital, the state provides for it. We were hoping to make use of it in the just transition. Last 8 minutes, if you have any question, may I make an addition? One of the questions says renewable energy, clean energy. I like the word clean better than renewable. Clean energy, like which is the one recommended, they asked. Now, renewable energy resources, when we say that, hydroelectric power plants, solar and wind energy, and what else was that? Hot water one, she means geothermal. It's these that we think obtained from waste, for instance. But in my opinion, the cleanest is solar energy. In solar energy, we should be concentrating. In Turkey, renewable energy, they say it's 30%, but most of these are hydroelectric power plants, and it's not logical for Turkey. And these are not without their damages. These hydroelectric power plants, as you know, they disrupt the ecological balance. And there's going to be water scarcity, and the efficiency of the hydroelectric power plants will be reduced. Why do we have so many hydroelectric power plants in Turkey? The share of solar seems like 1% as far as I know. Okay, investments are underway, but in my opinion, it is the least harmful. That's the road we should take, I think. Also, from Kütahya, Ahmet Dinç, journalist, I read what he has written. He says, can we benefit from coal in a better way because we have lots of it? No, unfortunately not, really, in our day. Really, obtaining energy from coal is not good for our future. We are of a certain age, but we have our children. And for their children, if we want to live a livable world, we should be exiting from coal. Coal, of course, gas, motoring, natural gas is also, as you know, a fossil fuel, but the least harmful one. And we are dependent abroad in natural gas. As a sunny country, Turkey should give a lot more weight to solar energy, I'm thinking. Thank you. Of course, this is a discussion about the area of energy. What we're doing here today is to emphasize the healthcare cost, because we keep repeating the same things in energy discussions. We should look into seeing how we can further reduce the healthcare cost. Anything, Anne, would you like to add something in conclusion? Or Sabahat Hoca, would you like to, if not?
Thank you, Funda. Yes, I wanted to underline that, in this discussion on the best energy forms, it's really important that we consider, we do an assessment, of the consequences to health, so that we actually consider, which energy form has which health consequences, and then consequently choose the ones with the least health impacts, because each, there are health considerations in each energy form. But if we're serious about protecting health, and we should be, because health is ultimately, the most important goal, then we need to have these health considerations integrated in all of the energy decisions. And from that perspective, it's very clear that none of the fossil fuels has any future, and there's also no bridge. Fossil gas is also not a solution, because again, it would lock in pollution for decades, and we should go for the real thing, for the healthy clean energy as soon as possible.
Çalışmanın sonuçları şu anda online olarak.
Results of the study you may access online, and everybody will receive the report in their emails. But in the chat box, I shared a link. You can have access to the main results. You're going to be finding a table there, for instance, the impact of power plants in Sivas and other places, for instance. And last, you'll see the work that has been done in those 4 regions in Turkish and in English. With your permission, I would like to close the meeting. And if anybody would like to say something, and I would like to thank our interpreter for being with us today. Thank you very much for sharing today with us, Sabahat Hoca. Thank you very much for all the information from that region. Thank you everyone who participated. Bye-bye. Bye-bye.